Fentanyl, history, present, and future. Introduction. Fentanyl, a powerful synthetic opioid, has gained significant attention due to its medical applications and the public health crisis linked to its misuse. This report provides a comprehensive overview of fentanyl's history, current status, and future prospects based on recent research and data. Historical background. Fentanyl was first synthesized in the 1960s by Dr. Paul Janssen, initially as an anesthetic and pain management drug. Its potency, estimated to be 50 to 100 times greater than that of morphine, made it a valuable tool in pain relief, especially for surgical procedures and severe pain management. By the 1970s, fentanyl and its derivatives began to see widespread clinical use, including formulations for transdermal buccal and intranasal administration. As the years progressed, however, the potential for abuse became apparent. Fentanyl's high potency and the ease with which it could be synthesized led to its illicit production and distribution. By the early 2000s, fentanyl analogs began appearing on the black market, contributing to a rise in overdose deaths. Current status. The current landscape of fentanyl use is alarming. Data from the National Institute on Drug Abuse indicates a dramatic increase in synthetic opioid-related deaths in the United States, rising from approximately 3,000 in 2013 to over 30,000 in 2018. Fentanyl-related fatalities now surpass those linked to heroin, indicating a shift in drug markets, particularly in regions like Canada and the eastern United States, where fentanyl has begun to replace heroin instead of merely adulterating it. Key statistics. Overdose deaths in 2018. Synthetic opioids accounted for more than 67% of all opioid-related deaths in the U.S. Market dynamics. Fentanyl's rise has caused significant changes in drug trafficking patterns, with it becoming a dominant substance in several drug markets. Public health crisis. The opioid epidemic has prompted widespread public health responses, including increased availability of naloxone, public education campaigns, and legislative efforts aimed at controlling prescription practices. Future prospects. Looking ahead, there are several avenues of research and potential developments regarding fentanyl and its derivatives. 1. Medical research and development. Ongoing research aims to develop new fentanyl analogs that maintain analgesic efficacy while minimizing the potential for abuse. Novel compounds may target opioid receptors more selectively, possibly providing pain relief with fewer side effects. 2. Multivalent ligands. Future investigations may focus on creating multivalent ligands that act on multiple targets within the pain pathway. These could offer new strategies for managing chronic and neuropathic pain, addressing both efficacy and safety concerns. 3. Policy and regulation. As the crisis evolves, policymakers are exploring regulations to mitigate the risks of fentanyl while ensuring its availability for legitimate medical use. This includes closer monitoring of prescriptions and enhancing the training of healthcare providers on opioid prescribing practices. 4. Public health initiatives. Public health strategies will likely continue to evolve, focusing on education, harm reduction, and increased access to treatment for substance use disorders. Programs that increase the availability of naloxone and promote safe use practices are critical in combating the epidemic. Conclusion. Fentanyl's history is marked by significant medical advancements and a corresponding rise in public health challenges. As research progresses and new strategies emerge, it is crucial to balance the need for effective pain management with the imperative to address the ongoing opioid crisis. Understanding fentanyl's complexities will be vital in shaping future healthcare policies and practices, ensuring that patients receive the care they need while minimizing the risks associated with opioid use. This report underscores the importance of continued vigilance, research, and compassionate care in navigating the multifaceted landscape of fentanyl and synthetic opioids. Counterintuitive information regarding fentanyl's history, present, and future includes the following points. 1. Therapeutic use versus abuse potential. fentanyl is recognized as a significant analgesic in medical practice, being 50 to 100 times more potent than morphine, which initially suggests a high therapeutic value. However, this very potency also contributes to its high potential for abuse and overdose, leading to a significant public health crisis, particularly in the US, where opioid overdose deaths surged dramatically. The juxtaposition of fentanyl being a vital pain management tool while simultaneously being a leading cause of overdose deaths is a stark contradiction. 2. Medical safety versus illicit use. Fentanyl has been noted for its high safety margin in clinical settings with minimal effects on cardiovascular and respiratory systems under controlled administration. Yet in illicit markets, its strength and availability have led to widespread misuse, often mixed with other drugs, making it a dangerous substance, contributing to a surge in overdose deaths. The transition from a medically safe drug to a significant player in the illegal drug market showcases the complexity of its dual existence. 3. Evolving drug markets. While fentanyl was initially used as a supplement to traditional opioids like heroin, it has now started to replace them in some markets entirely. This shift indicates that users are transitioning to fentanyl for its potency and availability, countering the expectation that users would seek out less potent alternatives. The complete replacement of heroin by fentanyl in certain areas challenges assumptions about drug user behavior and market dynamics. 4. Research and development stagnation. Despite significant investment in opioid research, most novel analgesics over the last few decades have been derivatives of existing opioids rather than entirely new compounds. This stagnation is counterintuitive in a field that often emphasizes innovation. The reliance on modifying existing drugs instead of discovering fundamentally new pain mechanisms reflects a broader issue in drug development that may not align with the rapid advancements seen in other medical fields. 5. Complexity of pain management. The notion that pain management could be simplified through potent opioids like fentanyl is challenged by the reality of chronic and neuropathic pain. The diversity of pain mechanisms indicates that a one-size-fits-all approach using highly potent opioids may not be effective for all patients and can lead to complications such as tolerance and dependence. This complexity suggests that future research may need to focus on multi-target or combination therapies rather than solely on increasing potency. 6. Bivalent ligands in pain treatment. Future research into bivalent ligands that target multiple receptors, e.g., both mu-opioid and delta-opioid receptors, offers a novel approach to pain management. The idea that combining different receptor activities could reduce side effects and improve analgesic efficacy is somewhat counterintuitive to the traditional focus on single-target drugs in pain management. 7. Lack of antagonists. Despite the development of numerous potent opioid agonists, there has been no corresponding development of equally potent opioid antagonists that can effectively counteract the effects of fentanyl and its analogs. This inconsistency raises questions about the balance of opioid medications, suggesting a gap in pharmacological research that has yet to be addressed. 8. Public perception versus scientific understanding. The public often views fentanyl solely as a dangerous drug due to its association with the opioid crisis, overshadowing its legitimate medical uses. This dichotomy highlights a gap between scientific understanding and public perception, which can hinder effective discussions around opioid prescribing practices and pain management strategies. These points illustrate the multifaceted challenges and contradictions surrounding fentanyl, emphasizing the need for nuanced discussions in both medical and public health contexts. Fentanyl is a potent synthetic opioid that has evolved significantly from its initial medical applications to its current status as a major contributor to the opioid crisis. The report on the history, present, and future of fentanyl outlines critical aspects that are often overlooked yet are vital for understanding the complexities and implications of its use. Overlooked aspects. 1. The duality of medical use and abuse potential. While fentanyl has legitimate medical applications, particularly in pain management, its potential for abuse is profound. This duality is often overshadowed by discussions centered on the opioid crisis. The significance lies in the fact that the very properties that make fentanyl an effective analgesic, its potency and rapid onset, also contribute to its appeal as a substance of misuse. Understanding this duality is essential for developing balanced public health policies that address pain management without exacerbating the addiction crisis. 2. Regional variations in fentanyl use. The report highlights that fentanyl and its analogs are not universally abused. Rather, their prevalence varies significantly by region. For instance, while synthetic opioids dominate certain urban areas, other regions may still see traditional opioids like heroin being the primary concern. This regional specificity is significant because it implies that interventions must be tailored to local drug use patterns, which is often not the case in broader public health responses. 3. Fentanyl's replacement of heroin. An important detail that may be overlooked is the extent to which fentanyl has not just supplemented but replaced heroin in some markets. This transition reflects a shift in drug supply chains and user preferences that complicate the narrative surrounding opioid use. It indicates a need for understanding the motivations behind this shift, including factors like availability, price, and perceived safety, which may drive users toward fentanyl. 4. The lack of effective antagonists. The report notes a significant gap in the development of effective antagonists for fentanyl and its analogs. This gap is crucial as it indicates an area of unmet medical need. While naloxone is widely recognized as an opioid antagonist, its effectiveness against highly potent analogs of fentanyl is limited. This limitation poses a significant challenge for emergency responders and healthcare providers in reversing overdoses, indicating a need for continued research into new antagonistic agents. 5. Future research directions. The report emphasizes the potential for developing new compounds that target multiple opioid receptors. This multi-target approach could lead to more effective pain management strategies that mitigate the risks of dependency and overdose. The significance here lies in a paradigm shift in drug development, moving away from singular receptor targeting to more complex pharmacological strategies that could reshape pain management and addiction treatments. 6. The role of synthetic opioids in global drug markets. The emergence of fentanyl as a dominant force in global drug markets, particularly in Canada and the eastern United States, illustrates a broader trend of synthetic opioids supplanting traditional narcotics. This shift underscores the need for international cooperation in drug policy and law enforcement, as synthetic opioids are often manufactured in one region and trafficked to another. The implications of this trend are significant for public health, law enforcement, and international relations. 7. Educational gaps in pain management. The report points out that despite the knowledge of fentanyl's risks, education regarding its use in pain management remains inadequate among healthcare providers. This educational gap is significant because it affects prescription practices and the overall approach to treating patients with chronic pain. Addressing this gap is essential for equipping healthcare providers with the necessary skills to balance effective pain management while minimizing the risk of abuse. Conclusion. The complexities surrounding fentanyl, from its therapeutic uses to its role in the opioid crisis, demand a nuanced understanding that incorporates the often overlooked aspects highlighted in the report. Fentanyl's trajectory from a medical breakthrough to a public health challenge exemplifies the need for comprehensive strategies that address both pain management and the risks of addiction. Future efforts must focus on targeted interventions, ongoing research into new therapeutic agents, and education for healthcare providers to navigate this challenging landscape effectively. For most valuable points for in-depth analysis and discussion on fentanyl, history, present, and future. 1. Historical evolution and medical significance. The synthesis of fentanyl in the 1960s marked a significant advancement in pain management, with its potency being 50 to 100 times greater than morphine. Initially utilized in surgical anesthesia and severe pain management, fentanyl's development represents a critical milestone in the evolution of analgesics. Understanding the historical context of its creation alongside the research surrounding its pharmacological properties provides insight into its importance in medical practice. The exploration of its derivatives such as fentanyl and alfentanil reveals ongoing efforts to improve analgesic efficacy and safety profiles, highlighting the duality of fentanyl as both a therapeutic agent and a substance with high abuse potential. 2. Public health crisis and overdose epidemic. The alarming rise in synthetic opioid-related deaths, particularly in the United States, underscores the public health crisis associated with fentanyl and its analogs. Data indicating a surge from approximately 3,000 deaths in 2013 to over 30,000 in 2018 emphasizes the urgent need for comprehensive strategies to combat opioid misuse and addiction. Fentanyl's role in surpassing heroin in overdose statistics illustrates its growing dominance in illicit drug markets, often being mixed with other substances, which increases the risk of unintentional overdoses. This point invites a discussion on harm reduction strategies, law enforcement responses, and public health interventions aimed at mitigating the consequences of fentanyl misuse. 3. Market dynamics and societal implications. Fentanyl's shift from a medically regulated substance to a dominant player in the illicit drug market reflects significant changes in drug dynamics. In various regions, fentanyl has not only adulterated existing drugs like heroin but has also replaced them, leading to discussions about market supply and demand, user behavior, and the socioeconomic factors contributing to opioid dependency. Analyzing these market dynamics can elucidate the complex interplay between drug availability, societal norms, and addiction patterns, making it a critical area for policymakers and public health officials to address. 4. Future directions in research and development. The future of fentanyl and its derivatives presents promising avenues for research, particularly in developing multi-target analgesics that could provide relief with reduced abuse potential. Innovations in synthetic methodologies and the exploration of ligands that target both mu-opioid and delta-opioid receptors may lead to new pain management strategies that are effective yet safer. Additionally, the potential for creating bivalent ligands that combine opioid agonism with other therapeutic actions, e.g., anti-inflammatory effects, opens new frontiers in drug design. This point emphasizes the importance of ongoing research in balancing the therapeutic benefits of fentanyl with the urgent need to address its associated risks. These 4 points provide a comprehensive framework for exploring the complexities surrounding fentanyl, from its historical significance to its implications in public health and future research directions. Each point invites further discussion and analysis, contributing to a deeper understanding of this potent substance and its multifaceted impact on society. 1. The Opium Wars 1839–1842 and 1856–1860. The Opium Wars were two conflicts in the mid-19th century involving China and Western powers, primarily Great Britain. The first war was triggered by China's attempts to suppress the opium trade, which was causing widespread addiction and social problems. The British, profiting from the opium trade, fought to maintain their trade rights, leading to China's defeat and the Treaty of Nanking, which ceded Hong Kong to Britain and opened several ports to British trade. The Second War further expanded British trade privileges and legalized the opium trade. These events highlight the intersection of drug trade, colonialism, and public health issues, much like the current crises surrounding opioid use and fentanyl. 2. The cocaine epidemic in the late 19th century. During the late 1800s, cocaine became widely used in various products, including tonics and medicines, often marketed as a cure-all. This period saw a surge in cocaine addiction and public health issues, leading to societal debates about regulation and control of narcotics. The eventual backlash resulted in stricter drug regulations, culminating in the Harrison Narcotics Tax Act of 1914, which effectively criminalized the non-medical use of cocaine and opiates. This historical case reflects the societal impacts of drug use and the eventual need for regulatory frameworks. Paralleling the contemporary challenges posed by fentanyl and synthetic opioids. 3. The heroin epidemic in the 1970s and 1980s. Heroin emerged as a major public health crisis in the United States during the 1970s and 1980s, fueled by its increasing availability and the rise of addiction in urban areas. The drug was often associated with crime, poverty, and social decay, leading to significant media coverage and public concern. In response, the government implemented various measures, including the establishment of the Drug Enforcement Administration (DEA) and the War on Drugs initiative aimed at combating drug trafficking and addiction. This historical context of heroin addiction and societal response mirrors the current opioid crisis, wherein fentanyl and its analogs have become prevalent, prompting similar concerns about addiction, health risks, and policy responses. Future outlook. Predictions for fentanyl and synthetic opioids. The opioid crisis has been a significant public health issue for several years, with synthetic opioids like fentanyl leading the charge. As we look towards the future, several trends and predictions can be made regarding the trajectory of fentanyl use, regulation, and research. 1. Increased regulation and monitoring. Governments and health organizations are likely to continue tightening regulations on opioid prescriptions to combat the rising rates of addiction and overdose deaths. Enhanced monitoring systems will be implemented, and healthcare providers will be required to adhere to stricter guidelines when prescribing opioids. Prescription drug monitoring programs (PDMPs) will become more sophisticated, leveraging technology to track prescription patterns and identify potential abuse. 2. Expansion of harm reduction strategies. Harm reduction strategies are predicted to become more prevalent in addressing the opioid crisis. Initiatives such as needle exchange programs, supervised consumption sites, and widespread distribution of naloxone, an opioid overdose reversal drug, will be expanded. These measures aim to reduce the number of fatalities associated with opioid overdoses and will likely be supported by both local and national governments. 3. Development of non-opioid pain management alternatives. As the dangers of opioids become more recognized, there will be a shift toward researching and developing non-opioid alternatives for pain management. This could include a greater emphasis on integrative approaches such as physical therapy, cognitive behavioral therapy, and the use of non-addictive medications. Advances in biotechnology may also lead to new classes of pain relief drugs that do not carry the same risks as opioids. 4. Increased public awareness and education. Public health campaigns will likely focus on educating the population about the risks associated with opioid use, particularly synthetic opioids like fentanyl. Increased awareness will foster a better understanding of addiction, the importance of mental health, and the need for comprehensive treatment options. Educational programs targeting youth will also be emphasized to prevent the onset of substance use disorders. 5. Continued research into fentanyl analogs. The pharmaceutical industry and academic researchers will continue to explore fentanyl analogs that may have safer profiles or therapeutic benefits without the same level of abuse potential. This includes investigating compounds that selectively target specific opioid receptors to minimize side effects. The development of dual-action drugs that can address pain while simultaneously reducing the likelihood of addiction will be a critical area of research. 6. Focus on personalized medicine. The future of pain management may see a shift towards personalized medicine, where treatment plans are tailored to the individual based on genetic, environmental, and lifestyle factors. Advanced genomic studies could lead to a better understanding of how different patients respond to opioids and other pain management therapies, allowing for more effective and safer prescribing practices. 7. International collaboration on opioid policies. Given the global nature of the opioid crisis, international collaboration will be essential in addressing the challenges posed by synthetic opioids. Countries will likely share data, research findings, and best practices to develop comprehensive strategies that can be adapted to local contexts. Global partnerships may also support the development of regulatory frameworks that can effectively manage the distribution and use of synthetic opioids. 8. Technological innovations in monitoring and treatment. Technological advancements will play a crucial role in the future of fentanyl management. Wearable devices that monitor vital signs or track opioid use could provide real-time data to healthcare providers, allowing for timely interventions. Additionally, telemedicine will likely expand access to addiction treatment services, improving outcomes for individuals struggling with opioid use disorder. 9. Potential for new synthetic opioids. While the focus will be on combating the current crisis, the illicit drug market may continue to evolve, leading to the emergence of new synthetic opioids. These substances could pose unique challenges in terms of regulation, detection, and treatment. Law enforcement and public health officials will need to remain vigilant and adaptable to respond to these emerging threats effectively. 10. Integration of mental health services. Recognizing the connection between mental health and substance use disorders, future strategies will likely integrate mental health services with addiction treatment. Programs designed to address the underlying psychological issues contributing to substance use will be essential in promoting long-term recovery and preventing relapse. Conclusion. The future of fentanyl and synthetic opioids will be shaped by a combination of regulatory changes, public health initiatives, and scientific advancements. While the challenges posed by these substances are significant, a multifaceted approach involving education, prevention, and treatment can help mitigate the opioid crisis and improve public health outcomes. Adaptability and collaboration will be key as society navigates the complexities of opioid use and addiction in the years to come.